5 on your health. And we're going to talk about measles right now because it is surpassing the total number of cases from 2024. And it's only mid-March, may I remind you. Last year, there were a total of 285 cases across the country. This year, so far, there have been 301 cases in 14 states. And if you do the math, that might be, if you average this many, might be 1,200 or so by the end of the year. Joining us right now is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. About a third of the cases involve children younger than 5, right? Is
That's
that
right.
true?
Yeah.
And dozens of people have been hospitalized. Sadly, one child is dead. What is your prediction for the rest of the year?
Well, you said it. There have been more cases in West Texas now than we had all last year in the United States. So, you know, the bottom line is also this area is rural and there's a lot of space in between, which you'd think would cause the measles to kind of go away. But the problem is people travel long distances, right, to go to church, to go to school, to the supermarket. So there's a lot of spread. It's difficult to get this under control. That's why the CDC sent their special epidemic intelligence service officers on ground there to help.
And not to expand that conversation, but the why now enters there because West Texas has always been that way, but why now is it expanding? But that, I'm sure they'll discover some theory about that. So the reason why I say we're talking about measles is, you know, the typical MMR vaccine is a 2-shot dose, and the first dose is around, the child gets it at a year old. The second dose is between ages, 4 and 6 or so. So that means that babies by definition are unvaccinated. Is it possible to get either shot earlier?
You can, okay? Most people just need their first dose at a year, next dose at 4 years. But if you're traveling internationally, or let's say you have to go to West Texas, if you're 6 months to 11 months, you can get your first dose. But then you forget about it. You forget it's your first dose. You still get the next dose between 12 and 15 months, and then the next dose at 4 to 6 years. But again, most children only need that one dose at 1 year.
Is there aside from the vaccine, is there any other way to protect yourself from the measles or your baby from the measles?
It's a trick question because the answer is it's the vaccine, it's the community immunity. Remember, you know, we look at West Texas and we say there's a problem, but across the United States, we're actually doing very well. But we know the reason why there are more cases in West Texas. It's not a mystery. It's because there's increased exemptions, meaning kids who are not getting vaccinated when they're young, and that's the reason. It's about 18%, okay? In Massachusetts, for example, we have about 93% of school-age kids vaccinated. And that's why we don't have a significant outbreak. But the more exemptions there are, the more we're going to see measles across the United States.
Dr. T, thanks for your expertise. Perfect.